What is the difference between borderline personality disorder and bipolar disorder? Watch this video to learn the 4 main distinctions between borderline and bipolar, and stay to the end to learn which type of bipolar disorder, 1 or 2, can be the most easily confused. Welcome to my channel. I'm Dr. B. I'm a board-certified physician, and I've been caring for patients for over 20 years. I make educational videos about interesting medical topics. Borderline personality disorder and bipolar disorder are very easy to confuse with one another. Borderline personality, or BPD, is a cluster B personality disorder, and bipolar is not a personality disorder, but is considered a mood disorder. But what does that mean? Well, BPD has the following characteristic symptoms: fear of abandonment, chronic emptiness and impulsivity, with suicidal tendencies, fits of rage, unstable relationships, with paranoia that can go into psychosis, with trouble distinguishing reality, and difficulty with memory of events. Now, these characteristic symptoms of BPD can sound a lot like bipolar, because they are. But in bipolar disorder, we really see 2 main features. Number 1 is major depression, and number 2 is mania or hypomania. So bipolar disorder is depression with the oppressive hopelessness and other common symptoms of depression, combined with intermittent mania, which is the opposite, because mania comes with unparalleled elation, energy, and euphoria or happiness. Now, self-damaging impulsivity, suicidal tendencies, instability of mood, and paranoia are all very common when someone with bipolar disorder is at the extremes of either depression or mania. They can have delusions and psychosis as well. This means, for an outside observer, BPD and bipolar disorder can look very similar, and they can be easily confused because there is so much overlap. So, what does differentiate them? Well, there are 4 criteria that can be looked at to help us distinguish. Number 1, fear of abandonment. Number 2, triggers or stressors. Number 3, chronic emptiness. And number 4, the presence or absence of a normal cycle. Number 1, fear of abandonment. Fear of abandonment is unique to BPD. This isn't typically seen in bipolar. Yes, in the extreme of depression, part of the hopelessness may include a component of fear of abandonment. But this fear is not always present, and it is not prominent in bipolar disorder. In contrast, with BPD, fear of abandonment is pervasive. It's in every relationship and social situation and context, includes family members, includes friends who are not texting, to a spouse being late for dinner. Number 2, triggers or stressors. In BPD, there is a relapsing cycle of anger, rage, and instability of mood. However, this cycle is very dependent on real or imagined stressors or triggers. Very often, these are very relational, from family, friends, or strangers. The cycle in bipolar is largely independent of these stressors. A child that chooses to not come home for school break will trigger a severe episode in a BPD patient, but this will not induce a manic or depressive episode in someone with bipolar. Bipolar cycles will run largely independent of the world around them. Number 3, chronic emptiness. A hallmark of personality disorders like BPD is the pervasiveness and constancy of symptoms like the chronic emptiness found in BPD. It is always present day in and day out, regardless of the social situation or the time of year. This is in contrast with bipolar disorder. Those with bipolar in a major depression can feel very empty and lonely. However, during the mania phase, this isn't present. This is a stark contrast to BPD. Number 4. The final difference between BPD and bipolar is the presence of a normal interval. What I mean by this is that those with bipolar disorder will have episodes of depression, episodes of mania. During both of these extremes, the mood will be very unstable and the person may exhibit all of those symptoms we've talked about. However, there is often an interval between these episodes that is relatively normal, and the bipolar patient experiences a relatively stable mood during this time period. This is in contrast to BPD, where all of the symptoms are present most of the time. Now, they may be lurking under the surface and not very evident for days or weeks, but as soon as a sufficient trigger occurs, the symptoms erupt. There is not a normal interval where the individual has complete mood stability. Bipolar 1, with its mania, which is so extreme, almost always inhibits normal function. or leads to hospitalization. This makes it much easier to distinguish from BPD than bipolar 2, because those with bipolar 2 have what's known as hypomanic episodes, and by definition, these don't seriously inhibit function and they don't lead to hospitalization. Those with bipolar 2 can be missed for years and underdiagnosed. Another very confusing fact is that you can have co-occurrence of borderline personality disorder and bipolar disorder. That is, you can have both present at the same time in the same person. I hope this helps you understand the difference between BPD and bipolar disorder. For more interesting videos, watch these videos on borderline personality triggers, the 9 traits of borderline personality, or this one on how to distinguish between bipolar 1 and bipolar 2 disorder. Thanks for watching, and please don't forget to hit subscribe below.